name's Marie Kirkland, and this is my video for my complete head-to-toe assessment with my patient Josh. Is it alright if I do a head-to-toe assessment on you today,
Please.
sir? Thank you. I'm going to start with your head, if that's alright. I'm going to touch your head. I'm looking for any bumps, cuts, bruises. I'm looking at the hair follicles and looking for any dryness. I don't see anything. I'm also going to be looking at your face, looking for symmetry. It's symmetrical bilaterally. Eyebrows are both in the same position. I'm going to check your eyes. The whites of your eyes are the good color. Everything is clear and moist. I'm looking at your nose. Nothing is shifted. It's all equal. I'm also looking at your ear structures. Everything is intact. Alright, and then I'm going to look inside your nose. Thank you. Everything looks good. Can you open your mouth for me, please? Thank you. Alright, it looks moist. There's no dryness. I don't see any cuts or bumps. Alright, you can close your mouth for me. I'm checking the alignment of everything. I don't see any ptosis or eye drooping in your face, so that's good. Alright, and then I checked the external structure of your nose. There's no lesions or anything. Your teeth look good. Uvula, I can see it's present. I can see your tonsils in the back, so everything is present like it should be. Next, I want to check your eyes. If you can stare straight at that wall, I'm going to be checking your pupils and making sure everything reacts properly. I'm looking at the size of the pupils. They're both equal bilaterally, and they're within the normal range of size. Alright, if you can just keep staring at that wall, I'm going to check your pupils' ability to react to light. So I'm going to be shining a light in your eyes, if that's alright. Alright, both pupils are reactive to light bilaterally. If you can keep staring at that wall, and then I'm going to bring the pen light in your view, and then I'm going to bring it closer to your nose. When I do that, if you could focus on the pen light, that'd be great. Thank you. Eyes are accommodating to the pen light. Now keep looking there. I'm going to make sure that your eyes are able to rotate in various positions. So I'm going to move the pen light to the side, up, down. When I do that, I want you to follow it, okay? Good job. Alright, so that's checking the ocular movement, cranial nerves 3, 4, and 6. So next I'm going to have you stand up and we're going to do the whisper test on you. Thank you. If you can scoot up a little bit, thank you. And if you can close your right ear with your hand, I'm going to whisper 3 numbers. And I want you to repeat those numbers back to me once you hear them, okay?
0, 4, and I believe a 5.
Good job. I'm going to do the same thing on the other side. If you can block off your left ear. Thank you.
2, 3, and I caught that curveball. Most definitely a second, too.
Good job. Thank you. You can go ahead and sit back down. Alright, I'm going to be checking your smile. Can you smile for me? Thank you. Can you raise your eyebrows? Alright, can you puff out your cheeks? Alright, everything is equal bilaterally. That's good, thank you. You can go ahead and unpuff your cheeks. Thank you. Alright, so you did all that. And then I'm going to check your nostrils again. Alright, so I'm going to do a smell test for you. Can you close your eyes? I want you to occlude your left nostril. And I want you to tell me when you smell something and what it smells like.
Is that alcohol?
Yes.
Or chloroform?
You were right the first time. Can you do the same thing on the right side?
Heavy whiff of that alcohol.
Okay, good. You can go ahead and take your hand out. Thank you. Alright, that positively tests for cranial nerve 1. Can I have you open your mouth and say ah?
Ah.
Thank you. All right. And I would verbalize. Normally I would check the gag reflex.
We can do that.
No, it's okay. The tongue the tongue is midline, so that's good. I also observed that when I checked your mouth. I also want you to close your eyes again. I'm going to check your sensation on your face. And when you feel something soft on your face, tell me when you feel it.
Very soft.
Okay.
Still screwing. It's not soft. It's soft. It's soft. Yeah. I feel like a paper towel, but it's soft.
Okay. As long as you could feel something.
Oh, I can definitely feel it. Soft.
Okay, good. Alright, next I want to check your extremities. I'm going to check skin integrity, skin turgor, if everything's bouncing back and you're well hydrated.
Feel
I'm
biceps.
feeling temperature.
Temperature.
Hair distribution, looking for any masses, any edema on the skin. None is present. That's good.
Those biceps are considered masses.
This was a good one.
Don't worry.
It's rude. Alright. So can I go ahead and have you shrug your shoulders against my hands? Okay, you can shrug them down. Thank you. Equal bilaterally. Strength is normal and able to push up and down. I'm also checking the bony prominences, making sure there's no breakage of the skin. Alright, and then can you grip my hands? Thank you. Can you put your feet down? Can you push up on my hands? With just your feet? Can you push down like gas pedals? Okay. Thank you. Okay. And that was all strong bilaterally with a rating of 5. Alright, and then now I'm going to auscultate the carotid arteries bilaterally. I will use my stethoscope. Alright, both bounding and present bilaterally. Alright, and then I would feel and palpate for the carotid pulses, but I would only do them one at a time so we don't occlude blood to the brain. I will also check for brachial pulses, radial pulses. I would check popliteals on both sides. And then the dorsalis pedialis. And then posterior tibialis. And they're all equal bilaterally and have a 2+ bounding pulse. Okay, and then next I'm going to now I'm going to inspect your thoracic cage. I'm making sure everything is moving bilaterally. When you breathe, there's no uneven spots. Everything is moving how it should. Your skin symmetry, shape configuration. Everything looks good. All right. And there's no shortness of breathing or no labored breathing. Next, I want to check your tactile firminitis. When I put my hands like this, can you say 99?
99. 98. 97.
Can you stand up? I'm going to do it on the back as well. Say 99.
99. 98. 97.
All right. You can go ahead and sit back down. Next, I want to percuss your lungs. there's normal sounds. I can hear dullness. Okay, next I want to osculate all your lungs. If you can stand back up again so I can listen to your posterior lung sounds. Alright, I've listened to the top left, and I'm going to compare each side. Alright, and then I'm going to do the sides, and again I'm going to compare each side with the other. Right? I'm going to check the front. All right, thank you. All right, next I want to have you lay down so I can listen to your heart sounds. So if you can just lay down with your head right there. Thank you. All right. So first I'm going to listen to your aortic and your second intercostal space on the right side. Right, and then I would listen to your pulmonic in the second intercostal space. I would listen to your second pulmonic, third intercostal space, your tricuspid, fourth intercostal space, and then your apical or mitral, which would be in the fifth intercostal space, mid-clavicular line. I would normally listen to that for 1 full minute, and I would also repeat on each position 5 times to make sure that I'm not hearing any heart murmurs. All right, next I'm going to auscultate. I would auscultate the apex. If you can bend your knees for me, I'm going to listen to your abdomen. That way we can just relax your stomach. I would inspect the skin, make sure I don't see any cuts, bumps, bruises, any distension. Next I'm going to first listen to any bowel sounds. And I would start in the right lower quadrant. And I will wait until I hear a bowel movement until I move into the next quadrant. Okay. The bowels were hyperactive. Alright, and color looks good. Contour, symmetry, everything looks good and normal in the abdomen. Alright, next I want to palpate your abdomen. I would start in the right lower quadrant, like I did before. And I'm just feeling for any abnormalities. I'm going to go down a few inches. Alright, and then I would also palpate and listen to the sounds heard. I did hear some dullness, and that's normal to hear for that area. Next, all right, and that concludes the physical assessment.